So let's discuss the other four parts of the upper end as well, which is greater tubercle, intertubercle circus, surgical neck and morphological neck. So first of all, greater tubercle. What is the greater tubercle? As you can see in the diagram, greater tubercle forms the lateral part of the upper end. Okay, you can find a lesser tubercle is can be found somewhere here medially, while greater tubercle will be found medially. Now what is intertubercle circus or bicipital groove? Okay, bicipital groove is found somewhere here in the mid of the greater tubercle and a lesser tubercle, and it separates the greater tubercle from the lesser tubercle. Also you can find a medial lip and a lateral lip on the bicipital group, which somehow indicates the downward prolongations of the greater tubercle and lesser tubercle. See this bicipital groove, okay, you will find medial lip and lateral lip here. Okay, this is the bicipital groove, and somehow you can find a lip like structure medially as well as laterally in the mid of it, which is called medial lip and lateral lip. Now coming to the surgical neck. What is surgical neck? See, I have drawn here. This is the anatomical neck. The upper dotted line is anatomical neck and the lower dotted line. Okay, you can clearly see a dotted line here. Okay, just below the anatomical neck. And what does this surgical neck shows? Surgical neck actually divides the upper end from the shaft. So it is anatomical neck divides head from the rest of the upper end, but surgical neck separates the upper end from the shaft. Okay, so it is found below the anatomical neck. Now coming to the morphological neck. Where is morphological neck located? It is situated just 0.5 centimeter above the surgical neck. Morphological fan you will find in between the anatomical neck and surgical necks, just 0.5 centimeter above the surgical neck you will find morphological neck. And what does this morphological neck signifies? It indicates the presence of the epiphyseal line here. So hope you are getting my lectures, you are understanding the lectures. If you are having any problems or you want to give any suggestion, you can type in the comment section. So next we would be studying about the shaft of the humerus.